I wonder how many people are suffering in silence.
31-year-old Christopher Mitchell is a writer and podcaster. He has been living with anxiety for about a decade and dealt with ADHD in his early years.
I lost my best friend Kyle in 2011 unexpectedly, and that kind of sent me for a loop.
At just 20 years old, Mitchell was lost.
I did not have the skills to cope with that loss. My inclination was to turn towards alcohol and whatever could numb that pain. And
eventually, he decided to reach out and find productive ways to cope.
In health class growing up, we never talked about any of this kind of stuff. It was all about the physical side of things. I had to do a lot of my own research.
But while pursuing solutions to his anxiety, Mitchell says he definitely felt the stigma that surrounds mental health issues.
You're meant to feel shame around that in some way. It's only in the last 2 years, probably, that I felt comfortable openly mentioning this. I would just love to see men feel more comfortable.
According to a 2018 study by Sunnybrook Health Sciences Centre, 1 million Canadian men suffer from major depression each year. That year, Statistics Canada also revealed that approximately 4,000 Canadians die by suicide each year. 75% of that number are men. Psychologist Maneet Bhatia says part of the problem is that men are more ashamed to reach out for help.
The problem here is men are socialized either by society or culturally to tough it out, suck it up. And all these things will then teach them either directly or indirectly that I shouldn't feel sad.
Bhatia says he sees more resistance from male clients when it comes to taking steps to protect and heal their mental health.
Part of the battle for men is making that first appointment, breaking that barrier. And the second thing I find often with men is a very, difficult time being vulnerable in therapy.
He says bottling up emotions can lead to physical and mental illnesses. He recommends pushing beyond the stigma and asking for help.
It's no different than going to your family doctor.
Bhatia says if you notice yourself being more irritable, have trouble sleeping, feel anxious, sad, or withdrawn, then reach out to your family doctor or a therapist for help. Reaching out for support is not a sign of weakness, it's one of courage. Sharmeen Somani, Global News.